it's Jesse. I'm here with my friend James.
Hi guys.
So James is one of our teacher trainee students that's in the 300 here at PureJoy, as well as he graduated last year with his 200, but he is also a
physical therapist of 10, 11 years now. And
you're getting your doctorate too, right?
I am, yes. Come December, January of this year, next year, I will become a doctor, Dr. James Lambert physical therapist. So I'm really excited about that. Yeah, it'd be fantastic. So,
that's wonderful. So it was kind of funny, like last year when you joined the 200, you're like, yeah, I'm a physical therapist. And I'm like, oh, I'm gonna have a physical therapist in my teacher training when I'm leading like anatomy, and my only knowledge of anatomy is through yoga. So, but I think it's really fascinating as we start to merge the two, physical therapy and yoga, which is what we're going to talk about today, right?
Yes, absolutely. So, as Jesse mentioned, I went into the 200-hour teacher training last year, and I graduated from that. And just because there's so much knowledge within yoga and the practices are so deep, I wanted to continue. So I'm doing my 300-hour with the studio here. And Jesse's kindly asked me to come in on her current 200-hour teacher training program to teach an anatomy portion, which I'm really excited about. Anatomy is, yeah, I love it, science, the body, and specifically the shoulder. And that's one of my most, interesting joints that I love particularly. Why? Because it has obviously 360 degrees of motion, which is amazing. And the way I kind of think about it is like the golf ball on the tee. You know, a pretty huge golf ball on a tiny little tee, and that kind of moves around a 3-degree plane of motion. And it only has one bony attachment, which is the sternoclavicular joint. So
where does that go from? That's like right here, right?
Yeah, so it's
like
pretty
this.
much the tiny...
So this is the manubrium, right?
That's correct, yes.
And then there's a little joint right here at the bottom of it?
Yeah, which is where your clavicle attaches to the manubrium. And that, it's only about that big, and that's your sternoclavicular joint. It has a small disc inside of it that allows the rotation, but also as we flex and abduct the shoulder joint, it kind of drops superior.
So if I wanted to feel this, I would put my hand like right about here?
No,
Higher
I
up?
would put it fingers, sorry Jesse, is it okay if I touch your shoulder? So just that particular joint, that is it. Right
this is it, right here.
That's it. Your sternoclavicular
so that's like kind of like the little notch, right?
Yeah,
of
yeah.
the manubrium.
Yeah, if you drop in that small little groove and arch, it's just to the right and the left, obviously, but it's the sternoclavicular joint, and that is the only bony attachment within the shoulder. The rest of the whole shoulder girdle is attached through muscles, ligaments, and tendons. Wow. Which is quite amazing.
So like, if I hold my arm out, it feels like this is all solid though, right?
Absolutely, but that is all through soft tissue.
Yeah.
You know, the only true bony attachment is through that one small joint.
Just right here. This is my shoulder joint.
That, yeah, really.
It's funny to think about because we often think about the shoulder joint as this, but that articulates all of this range of motion.
Yeah, absolutely, yeah.
Ah.
With the scapula, that big, thank you Jesse, that big piece of bone on the back, your shoulder girdle, shoulder blade, the scapula, huge amounts of muscle attachments underneath, on top, to the sides, the bottom, that will provide the foundation and the stability for this glenohumeral joint to lift and abduct the whole arm, but then coming around to the front through your clavicle, and then attaches on to, so this is your axial skeleton, all your arms and your legs, and that attach appendicular.
Oh,
Jesse, thank you so much.
No, it's only because we're doing the spine the weekend before you get in, so we've been talking. We're talking about axial.
Yeah, and then the axial and the appendicular.
Yeah.
Yeah.
So, what about somebody like me who tends to round because I've spent so many years on the computer?
Sure.
Right. So when we're looking at this and we come into our yoga postures, it tends to come.
Yes.
What would you recommend?
So, a couple of things. With that rounded, protracted shoulder position where the scapula is protracted, and abducted, you're probably going to have some abduction and probably some winging and tipping of that scapula on the chest wall.
And the winging is when it looks like it's poking out behind,
yeah,
right?
On that inferior medial border angle, you will get that pokiness, that notch, and then the tipping as everything comes forwards on the shoulder girdle. So there's a couple of things. Obviously the shoulder muscles on the back here, the rhomboids, the mid, the lower traps, they need to be activated and strengthened, because in this position they're all going to be lengthened and underactive because they're in that lengthened position. So we need to work on activating those and shortening them and strengthening them. And then if we just turn to the side slightly, if we're in this position, you can see where her shoulder girdle is in relation to her ear and her neck and her head. It's all obviously forwards.
Is this creating like more weight on my head too, like for my body and my spine to carry?
Absolutely. If you put like a plumb line or a center of gravity line through her whole body, the majority of her body tissue is going to be forwards of that center of gravity line.
So rather than
absolutely,
once we come right here and it's distributed evenly all the way down.
Yeah, so it's trying to find balance, and obviously within yoga that is key, finding that balance between the correct form. So there are muscles on the front. Pectoralis minor probably is tight, even pec major.
Pulled this way, right? So
absolutely.
The pecs come out and around all the way to the front ribs, right?
Yeah, all the way through the front ribs, sort of your chest bone, underneath your chest tissue, that attach onto the front part, on the lesser tubercle of the humerus.
So there's a lot going on right here, right?
There's a ton of stuff, and then that's just from the front and the back, but inside, underneath, you've got the subscapularis muscle and then the serratus anterior. That
are these the deep ones you're telling me about that come all the way down and through, right?
Underneath that shoulder girdle, that, you know, in any downward facing dog particularly, you know, if that scapula, that foundation of support is not stable and strong.
It's like right here, when we're in down dog, what's that gonna look like?
You're gonna have a rounded shoulder position, but if you haven't got the stability here, you know, you're gonna put pressure through the elbow, possibly locking and propping, and then some collapse down at the wrist.
And that'll probably look more like this too, right?
Yeah, everything is, and the prana is going to be lost at certain points.
We love that prana out here.
Yes, important, integral.
Well, so I'm super excited that you're coming in. We're going to be doing functional anatomy with a lecture on anatomy of the shoulders. We are getting into the arms as well, but more of a focus on the shoulders because it is such an important joint.
Absolutely.
In the body.
The foundation, and you know, it's working from the ground up to a certain extent. For me as a PT, the ground for me of the upper extremity, this is ground zero, this is the base, this is the, you know, the support. So then I know, you know, obviously from a yoga perspective, the ground up obviously is, you know, from the feet, the knee and the hip, and working on that. But from a medical perspective, I guess, yeah, not to confuse anyone or anything, but yeah, this is key, this is fundamental. And if this is stable and strong, it will provide support further down the arm and the hand and the wrist, which, you know, needs stability and support.
So should we give them a taste of kind of what we talked about while we were planning for your visit to the training?
Yes.
I think it's fascinating. We were talking about Garudasana, eagle posture, and the arms for that, which isn't always available.
No, and I mean, I can demonstrate just because my left shoulder is particularly tight. I've just completed an Ironman, so I've done lots of swimming and cycling over the last 7 months, pretty much. So my left shoulder is tight anyway, but in this position, you can see my left hand here. I can't get much past that point because my capsule and some of the tissues on the back, my infraspinatus, teres minor, probably are a little bit tight, so I can't externally rotate particularly well. But if I swap with my right, I can come to midline. So you can see that's quite noticeable. I get to there and I'm struggling, and I can feel
that's
the tension.
fascinating. And as someone with only a background in like yoga anatomy, and the assumption is that just everybody can do this or this, right, where the arms are married. When I started teaching yoga and people it wasn't happening, and we had to come back to this place, and even then sometimes it's not pressing.
Sure.
Like we were trying to decipher what's happening in the body here if they can't come together, and I thought your answer was fascinating. If you want to share which muscles, what area.
So if you're bringing your elbows in together in that position, you're going to be activating those pec muscles pretty much.
Yeah, they can feel that.
Yeah, and probably getting some subscap, which sits underneath the shoulder blades, which is way kind of back here, but it helps to internally rotate the shoulder and the arm and the hand. So you're going to be firing up, yeah, on the front of the body, but underneath the shoulder blade as well. But again, you can be active and strong in those muscles, but if the tissues on the back of the joint of the shoulder are not particularly loose and allowing that motion, you're going to be restricted and tight, pretty much like me in a way. I mean, I can get to that position, but again, I can feel restrictions straight away, pretty much. So.
Well, we also talked about how some of us have an advantage, and it's so our practice is unique to each of us, and we were talking earlier about how some of us have more of an advantage in order to get our arms in certain things, even with, let's say, a bind, which we're going to be going through in the teacher training weekend. But for myself, I have what's known as carrying arms. And is that a term that you're familiar with? Do they use that in physical therapy, or it's just like, that's just the shape of your arms?
I have heard of that term before, but I wouldn't necessarily say it's like a scientific sort of term, if you like. I don't think it is.
Yeah, I think it's weird, but
general descriptive.
So the idea is, see how my elbows are closer to my hips, as opposed to somebody who may be more like this. Is that right?
Yeah.
So for me, when I stand normal, instead of out here.
Yeah.
You see how I go hypermobile? I go out there.
Are you? I mean, you have got some excessive range there. So yeah, it's slightly hypermobile.
It's kind of nice, huh?
What's your wrist function? So let's just take the elbow off and relax the elbow. Let's not wind you up too much. And then your thumb.
Yeah. It's not like this one. This one that people do.
Yeah. So yeah, you probably got some excessive mobility within your body and your structure, which I think, coming back to that position of the carrying hands. Yeah, it's more sort of genetic and biomechanical makeup and body composition over structural or any like issue as such that you have. It is just the way you're made. But with certain things like hypermobility, especially at the elbows, well, everywhere, the elbows, the wrists and the shoulders.
Do you want to see how good I can do it?
Yeah, go for it, yeah. Yikes. So...
And it'll...
Wow. So that's a prime example of some excessive laxity within the ligaments and the tissues. Yikes.
It's like they can stay up the whole time as the arms go.
Wow. It's a good party trick.
We'll definitely have a video on downward facing dog for somebody like myself.
Which, with excessive range, you need stability to help protect your joints and everything.
So what happens, we were talking about this in the last training, what happens if we do just hang out on our joints? Like, there's whole schools of yoga that say, stack your joints and then lock out, and that creates your support. So we're going to be going through side plank in the training, and if I were to take that locked out completely, stacking my joints, and they also talk about this thing where you plug, where you would like plug the humerus in, so the humerus, the upper arm bone.
Yeah,
see, the world needs more of you to tell us why we should or should not. So what do you think would happen in the long term if side plank, so that's done like if I was horizontal, right, and I'm putting all of the weight onto my hand to hold this whole thing up. And again, mind you, I tend to round, so that might look a little bit different, but if I was able to get that on the back and then plug it in, what do you see that could possibly happen in the long term of doing a practice like this?
I mean, the long term of practice, if you're locking out and propping through that joint, you're probably going to have an element of collapse, because, I mean, for one, you're losing that prana at that particular joint. But from a physical perspective, if you're locking out any joint, the soft tissues around that are not going to be active, so there's no protection of that joint. So the synovial joint, the capsule, and the ligaments surrounding that joint, you're putting tension. So there's no activity through the muscle, right? So,
but the muscle is set up to actually take on activity because it can tear and come back together just fine, right? Like it rips and grows back stronger.
It does.
At some points.
The muscle.
The muscle.
Yeah.
But if we're working into tendon and ligaments, how does that look? Because there's not as much blood that moves into it.
Yeah, exactly. You know, a ligament or a tendon is a non-contractile tissue.
Put my arm down, that kind of hurt.
Is a non-contractile tissue. There is a degree of freedom within a ligament and a tendon. There is some play, but they have a lot of tensile structure, so they don't have a lot of blood flow. They're a very poor vascularized structure, so any kind of injury that happens to that structure, it takes a long time to heal. Like anyone that tears an ACL or a ligament or a ulnar collateral ligament or a lateral collateral ligament, it takes even longer to heal properly than a bone.
And that's with like not using it, right? Like you pretty much have to take it out of the equation and limit your exercise and mobility to try and heal it.
Absolutely.
As opposed to like the muscle where if it tears, you can just come back and do it again and it keeps regrowing and building stronger.
Absolutely. A muscle will heal within a matter of weeks, if not days, you know, weeks, depending on the severity of the tear, but it has such a high blood supply, you know, it's so much oxygen, nutrients that it will heal quite quickly compared to a ligament that doesn't have a lot of blood flow. So yeah, if you're locking and propping out that joint, all of the tension is being transferred to the ligaments and the capsule around that elbow joint, and over time it's just going to become more and more stretched. So you're going to get more range and you're going to put more load through those tissues and structures. So then over time, potentially you could rupture or damage some of those ligaments, and you're going to just put more wear and tear on the synovial capsule and the articulation of the bones. So I mean, potentially long term you could say that you're going to develop osteoarthritis or have an increased risk of osteoarthritis if you're putting tension through that joint, which, you know.
So what I think that I'm hearing you say is that if we use the muscles surrounding the joint, it will help protect our joints, and we need to make sure to stay active through those muscles.
Absolutely, 100% agree. 100% agree. Yes.
Well, thank you.
Yes.
Awesome.
Really important. Yeah.
So I hope you guys have enjoyed this installment. We are going to have James out to PureJoy. He's going to be starting a yoga and physical therapy type of workshop. Hopefully we'll get more into the shoulder with you on the training weekend.
Absolutely. Yes.
And look out for him online on Instagram. It's
Dr. James PT Yoga is my handle. I've put up a couple of videos on my IGTV page.
We'll be sure to tag him here so you guys can follow him too. Thanks, guys.
Thank you very much.